Happy Monday, everyone. Mark and I would like to welcome you to session 3 of the demonstration. And as you know, Mark and I are both education leads here at Ontario Health. So if you didn't get a chance to be with us for session 1 and 2, we just want to highlight a few of the things that we did cover. So in session 1 and 2, we met Athena Demo, our patient, and we followed Athena in her health journey to highlight some of the key functionalities of CRIS in the assessment platform. So in session 1, we initiated the CRIS patient record from the e-referral. We initiated the integration of the assessment platform where we completed the inter-eye contact assessment. We determined Athena eligible. We initiated personal support services, provided an ODB card, and we wrapped that all up with our documentation and workload. In session 2, we performed a client search for Athena and reviewed the care coordinator dashboard, where we did note that there was an assessment task stating that it was time for reassessment. So we conducted a home visit where we completed the inter-eye home care, ordered medical equipment and supplies, reviewed the document library and uploaded a medication list, and sent our colleague a manual task to follow up. We ended our session with Athena having a medical emergency and was admitted to hospital, and the file was put on hospital hold. So for today, we start by reviewing the notification that alerts us that our patient Athena has been admitted to hospital. This is called an e-notification. And from here, we do many of the same steps that we've highlighted in the other sessions. So for today, we will remove the hospital hold and move from there into other CRIS functionality. Just a reminder, by following Athena on her journey for these demonstrations, we're just highlighting some of the key functionalities and not every part of the process. Mark, hand it off to you.
All right. Thank you, Lisa, and welcome everyone. Good to see you all. Let me start by sharing my screen. Okay. All right. So I've got it today. I've got the font larger. I've got zoomed in a bit. So hopefully everyone can see this pretty clearly. I will also put off my camera at this point. Yeah. So as Lisa said, we're kicking off today's session with just continuing with the story. This will probably be the last little portion of the story, and later on today we'll just focus on other functionality and the things that have come up in some of the questions and interests from day 1 and 2. So as Lisa mentioned, when we last met our patient, she was in a hospital hold, and we are going to be removing that hospital hold because we received a notification by e-notification, and I'm just going to navigate now to the tasks tab. So we get an e-notification, electronic that's not what I want. Electronic notification when patients get admitted to the emergency department, when they get discharged from hospital. Other circumstances as well, but the way we monitor the queue is under the tasks tab at the system level, and over here, similar to what we did on day 2, I think, when we were monitoring day 1, monitoring the e-referrals, we also have e-notifications here. So I'm going to click on that hyperlink, and there's different ways to sort and filter and select what incoming and the kinds of notifications you want and from where and so forth. But I'm just going to basically scroll down in the list here. Sorry. And where are we here? I should be finding my patient already. I just did this morning. Why am I not seeing this? What am I missing? I'm sorry, guys. I just did this morning, so I'm looking for. I wonder if I can just sort by name here. What's happening?
Mark, you can. I know that they're sitting in the Athena's dashboard. If you wanted to go from there.
Oh,
if
okay.
If this isn't working.
Yeah, that's a good idea. Thank you for that. So I apologize, folks. I should just see in that queue of those lists of names. You'll just see them coming in chronological order. One of those will be the patient that I was looking for. I don't know why I'm not seeing. Oh, I know why. I know why now. I'm in the wrong environment. Sorry about that. I was just doing some testing for the Provincial view, which I'll show you later. That will do the trick. Okay, sorry about that. Okay, e-notifications. So here we are. So you see two notifications. One would have come on Friday when the patient was admitted to hospital. Client is admitted to inpatient unit. You can see which hospital they went to, their primary caseload that they're currently assigned to, when that was generated, patient number, and the name. I'm going to go to the second one, which is what we're actually doing today. The client is now discharged from the inpatient unit. So I would clicking on the name. I believe it will take me into the patient record, but I want to look at the notification itself. So this is just, there's not a lot to do with this. It's just a notification to let you know that this happened. And there's some, so you can see here the client name, event type was their discharge from inpatient unit, date and time. This is where the hospital it came from. And some simple basic information like the presenting problem is here. And some additional information here. It says no respiratory status distress at this time, and so forth. So you get a little bit of a snapshot, a bit of information about the patient here. And then from there, you can go right into the patient record to proceed and do whatever you needed to do. So I'm going to, actually, I want to show you one other thing just quickly under the e-notification screen. From here, if I was to just click on that line, that notification I received, you'll see some additional buttons kind of appear, things I can do. So I can assign this if I'm someone who monitors the notification queue, I can assign that to myself or unassign it or mark it as complete so other people don't pick it up. So there's a little bit of functionality there. Otherwise, I'm just going to proceed and get into the patient record. So I could have done a search, like a client search, like we've shown you last week, or you click on the hyperlink right in the notification, and that will take you into the patient record, which is where we are. And you can see if you were here Friday, you'll remember that we see the status of the patient is on hold. You see that yellow and red flag here at the top of the chart. So it's pretty simple, pretty easy, loud and clear that this patient is on hold. So what we're going to do now, as some of you might have guessed, if you are starting to get familiar with the functionality, I can go to the action drop down here and select place off hold. I think if I chose place on hold, it'll say client is already on hold. I can't remember exactly, but let's do place off hold. And it's pretty straightforward. So we're going to select, we had the estimated end date of, we usually does 14 days. So whenever it was set to, regardless of when it was set to be off hold or estimated, we're going to end that hold today. Okay, and you can't future date the off hold from here. You can do it from in the past if you had to, but I'm just going to do it as of today. And then we're going to select the present location, right? So you need to indicate, so if they're not on hold, they might not necessarily be going back to their home. So we're just going to make sure that we're selecting the home address as their current location where they are now. Okay, and then I'm going to click save. Okay, and that just shows you, just to confirm that it takes me to the address screen. So if I was to make any adjustments or change the present location, you can do that from here. You can see it by default. There's a star here next to that home address. So it's just confirming that the patient is at the home address again. That's their present location. Okay, and that's the off hold process. What it will do is trigger a notification to the service provider. I'm going to show you on the HPG side of things, the Health Partner Gateway. That's where the kind of portal between the service providers and vendors and what have you, between them and Chris. And we're going to show you later on some of the notifications and document sharing and incoming referrals and so forth that they see on their side, and do a little bit of a two-way communication between those two. So that's taking the patient off hold, and you can see now that previously it had a present location field that talked about where they were at. They were at the hospital, but now they're just showing up as being at the home address again, and the status is back to active. All right, so that is taking the patient off hold. The next thing I want to show you, we're kind of now getting into just different things that we can do. We're kind of abandoning the story, if you will, at this point. And I wanted to show you the coordinated care plan. And that, because they came out of hospital or they went into hospital, perhaps something had changed in the care plan. So I'm gonna go over to that document and show you. Oh, sorry, under health profile. Okay, so under the health profile, this is still at the client level, and I'm gonna go over to this hyperlink, the coordinated care plan. So this is a care plan that's available you can make it available to whoever is involved, the different provider agencies and even primary care agencies, people who are associated with the circle of care for this patient. So you deliberately select who can or cannot, well, you don't decide who can't, you just choose who can see the coordinated care plan. And it's a good way just to have an overall snapshot of the different features. It's got things like what's most important to me. It talks about who's the care team, consent directives, different health issues, allergies, medication management, goals, and their action plan, things like that. I'm going to show you how it works by clicking on Add Care Plan, and then I'm going to indicate who can access that, and I'm going to show you on the HPG side what that looks like. So I'm going to say Add Coordinated Care Plan, and you can see here's all the different sections of the care plan. I'm going to go in below and just update one section, maybe one or two sections. So, for example, here there's a section called "What's Most Important to Me and My Concerns." So, and this is from the perspective of the patient in this particular section. So I'm going to update that portion and say what's most important to me right now, maybe being able to go for walks with my husband, Bruce. I think it was Bruce. Oops, Bruce. Okay. And maybe what concerns me most right now, not being able to recover enough to fully, engage with my family independently. I don't know. I'm not a care coordinator, so I don't have the right language exactly, but that's just an example. And I can say save care plan, save that section. Perhaps below, I think there's a section for allergies. I just want to show you a couple of sections here. Allergies. We've already indicated elsewhere. So we said cat dander, and we said hives, I think is what Lisa said. So I'm going to save that portion. So it's a quite in-depth and detailed care plan, as you can see. You continue fleshing it out and updating it, usually at the time of assessment. But the good part of it is that whoever is in the circle of care that you choose to make to have access to, the care plan can also update it as well in real time and make it available for others who also have the access to the care plan to see that in real time. So I think I just need to go back to this coordinated care plan list. And I'm going to go to care plan access here. And you can see just a bit of history here. You can see that it's an active in progress, when it was updated and by whom. And if I'm going to now select share care plan access, it was provider. And I think by default, right, I went to Bayshore. Okay, so we have here that Bayshore Home Health has access to the record. You can make that available or not. And then I don't remember if I need to click save. I think it just automatically will make it available to that service provider as well. So that I just wanted to show you kind of a very simple overview of what it is and how you can make it available for sharing and how you can update it pretty quickly for others to see. There's also an audit log here. So this is just the care plan itself. Next to that, there's a tab called audit log, where maybe I'll come back to this after, because I'm going to make some adjustments on the provider side in a moment. But you can kind of see a history of who updated it, where are they from, and what was changed, what section of it was updated. So I did, it says here it was viewed by me. I updated the allergies, updated the what's important to me and my concerns. Yeah. So I'm going to, we'll show a little bit later what that looks like on the HPG side. So at this point, we talked about, I think there was some interest, or it's relevant for this audience, about having community support services as another kind of service type or referral. So what I will do is I'm going to add another referral type for community support services, and then when I'm going to go in after that to HPG, the Health Partner Gateway, and so that you can see the different referrals and the services, and just make a bit of a more robust experience of what you'll see on the provider side. I'm going to go back to the overview tab, and I need my notes for this part. Adding community support services. Okay. So if you remember from last week on Thursday, I believe it was, we ordered personal support work service, and that was using what was called the Service Wizard. And we also added the home care referral with the Admit Wizard. So I'm going to be using the Admit Wizard again, just as like a quick shortcut way of adding another referral, and then I'm going to add community support services on top of that afterwards. So starting with the Admit Wizard, I'm going to select Go. And then again, as always, I'm just looking for the mandatory fields. I'm going to be doing community services as the service type. For the specialty program is community support. There we go. I think COPD was our diagnosis for this patient. And then I believe should be able to do automatic caseload assignment. Sorry, I'm not sure, Navenka, if you're on the call. Oh, here we go. No, it's not going. If I choose select caseload, then running a bit slow today. Here we go. Okay. I'm just choosing the same team for now, just out of convenience. But this automatic caseload assignment should work. It's just, we're in a testing environment again, so it's not working perfectly. And then I'll click Save. We'll return to the Overview tab just to show you that referral, and then I'm going to add some service under that referral. Okay, so here I am back at the client level overview screen, our home base, our blue overview. Scrolling down a bit, now we can see we've got two referrals. We saw home care from last week, and now we've got our community services with the relevant details under that. Admit date, primary team, caseload, who's assigned to it. Okay. So to order service, there's a couple ways I can do this. I'm not going to click on that referral itself. Just click on community services. And under that referral, I'm going to use the drop down, the action drop down, add service agency. Right now, depending on the kind of referral, the kind of contract, sometimes we can do the admission, the adding the referral and ordering the service all at once. That's how we did it last week with the personal support. Just right now, I'm showing you another way where you can kind of do that separately. And for the service, I'm going to select community paramedicine. And then the client accepts referrals. I'm going to say yes. I don't have any particular notes that I'm going to add. I'm looking for the mandatory fields. Authorization date is today. I'm just going to select the home address as the address to provide that service at. And then I will select to add agency. So down at the bottom, there's a button here to add agency. And I just need my notes for this as well. Able Living, PSW, client accepts, set that for yes, and then I will select next. All right. And then as before, we have the option to indicate I can select any assessments that are in the referral that we've got on file. I can choose to select any documents. So today we can show you we've got a couple documents in the document library that were uploaded. I can just choose to select one of those, perhaps. If I didn't want it, if I made a mistake, I didn't mean to select that one. This is now the documents in the package, so I can just remove that again and select the other one instead, whatever's appropriate. Okay. If I needed to go back and make any changes, there's a previous button here that just walks me through those couple pages. Otherwise, I'm going to click send. Is not shared with an agency. Why am I not? Okay, I'm going to leave that alone for now. I can't remember what to put here. So I think there's at one point where I have the ability to make it shareable before selecting it here. So I'm just going to leave that and click send. Little hiccup. All right. So that now is HPG referral management access. So I'm able to access this in HPG. If I go to our overview on the home base, we'll now see again, both those referrals are in place, and then below I can see services for home care and services for the community services referral. And that's it. So that's how we add another referral and another service type. I know I think there's a couple of questions in the chat. Well, I think as we normally do, we're going to save those for the end. We should have a bit more time today than we normally do, I think. But at this point now, I'm going to move over to HPG and kind of shift gears and show you what things look like on the provider side of things, or yeah, I'll just leave it at that on the provider side. So just give me a moment. Okay. So here we are, we have the HPG Health Partner Gateway. Now I was in here this morning getting things set up, and it didn't keep me, because again, it's a testing environment. It doesn't keep me logged in for a very long time if it's not active. So just let me make sure I log myself back in there. And actually, yeah, okay, there we go. Maybe if I make it a bit bigger. Okay, so Health Partner Gateway. Some of you are familiar with this already. I mentioned before how it's like a portal, right? It's another website, if you will, that enables me to look into the CRIS record and see certain key information that's been made available, deliberately chosen to be shared with the service providers. It's also a place where you can see incoming service offers. You can share documents bi-directionally, right? So from CRIS, we can share documents and share notes with users of HPG, and someone from HPG service provider can also send notifications and share to upload documents, send reports as well. We talked about how they have access and can edit the coordinated care plan, which we saw a bit earlier today. So we'll just get into it. I just want to show you, first of all, there's different ways to do this. It kind of depends on the type of contract, I believe, or how it's set up, I should say, actually in HPG. And I want to make this field as large as possible. So this is kind of like an incoming queue, if you will. There's another place to do this, but it's not set up to do it for this particular provider. But this is just a list of the incoming documents or referrals, offers. You can see notifications of the on-off hold are here. Documents being shared are here. If there's a kind of contract that has service frequencies, you can see updates of changes to the frequencies or the service plan, shared notes, just kind of like an inbox of things coming in to HPG to be made aware of, kind of be notifications of different things. And like I said, this is just one way. It's not even necessarily the best way. There's also an offer queue to be monitored, a document sharing screen, but it's not. I'm not set up to view it that way. So I just kind of see this single inbox here, kind of like an email inbox, if you will. Okay, so that's a way of seeing information that's coming in. I'm going to spend most of this time in a client record. So I'm going to do a client search here. And I'm going to go by, just because it's fast to do it this way, I'm going to select Athena by first name, but you've got other search parameters similar to how we had in Chris. Sorry, it was slow for me this morning as well. It's sometimes the test environments are a bit slow in the morning. Sorry about that. Okay. So we'll use, we see below a number of examples of patients that have got the same name, Athena. I'm going to select the first one, demo 2. That's been our patient along our journey so far. Okay. So first of all, when you click on the, I'll highlight some of the key things. I won't show you everything right now, but as the page takes a little bit of time for the screen to load up as well. So you see basic information like the demographic details, the client number here, the fact that the client is active. And a lot of this information you're seeing on this screen you might recognize it as some of the content that you see on the main overview tab, kind of like the home base, right? So demographic details, again, some consent, present location, information about the assessment is listed here as well. And then some of the other details, they're kind of not expanded by default. So I thought there might be an expand all button, but there's some, you can open any of these, and we know that they were allergic to the cats, for example. We had the diagnosis information, right? So a lot of this is just pulled right from the overview tab, the summary of all the details that we saw in Chris. We've got a listing of the referral types and the services in place. Okay, so we can see those 2 referrals now. That's kind of why I wanted to do the community service one first. Okay, equipment and rental. So again, it's just like a nice summary, replicating a lot of what we saw in the overview tab in Chris. Oh, here it is, expand all. That's what I should have done the first time. There we go. All right, I think this patient has some shared notes. Yeah, so I went in this morning, and the note that we created on Friday, we just did a note about the new referral that had the care plan listed there as well. So this is just showing you that note. I didn't actually document the note. It just has the headings and so forth, but this is a note that was deliberately shared. So you see the list of notes in Chris, and you would, as a Chris user, you would just check off the note or notes that you wanted to make available for the service provider to see, and this is where they would see that. I'm going to come back to shared documents in a moment here. Well, let's do that now. I think for this one, I actually had a different patient. So the inter-eye contact assessment is available here as well. It was made available as like a document type. I haven't clicked on this before, so I just want to see what happens. This will be a first. Sorry for the waiting time. Yeah, so it comes up as a PDF format here. Okay, so if you're familiar with the inter-eye assessment, this is just the output in a PDF format. Okay, so that's available to you. I'm going to close that. And I had another patient. I can show it if you like. It's just a document that I did share. I think it was a medical order. So at the bottom of this screen, from the document library, I made available down to the very bottom of the screen here. There was a document. It's kind of like a document library, documents that were shared from HPG. I didn't have a chance to do one for this patient yet, but it would just show up below here, and you would click on the hyperlink, and that document would open as well. I can find that in another patient if you want to see that. CSR uploads, I don't know if this is relevant in our case here, but this is where the providers can send their reports, provider reports, and make them available in the document library in Chris. It's a little bit similar to uploading a document in Chris directly. So for example, we're talking about personal support. So I'm just selecting the service type. The document type would be provider here, like an initial report, for example, maybe a discharge report. Again, I'm not sure that will be relevant in this case, in your case, but just to show you an example of how you can go about doing that. And then it's kind of like doing an attachment, right? So I can choose file and select a document. I'm just choosing something here as an example. And click send. Now, when I tested this earlier, it didn't work in this environment. So I get a confirmation. Would you like to proceed? Yeah, has been successfully completed. Posted. So it should be, we can look at later back in Chris again, but it should appear now in the document library. And as you might guess, it also will trigger a notification, like a task, that the coordinator or whoever monitors that patient's record, that caseload, will receive a notification that a document was uploaded. Yeah. And then any documents that have been sent, you can see here, this is kind of like, this is a nice feature. Maybe I can go into Chris afterwards to demonstrate, but this is a history of reports or documents that were sent, and you can kind of see the status of what's happening on the Chris side. So far, both of these are showing up as, one is showing up as being submitted. They're kind of color coded. Sometimes the coordinator on the Chris side will do an action on the document depending on what that action, what the kind of document is. So you can see that there's a review that's pending. Maybe it's just in progress, which means that they're clicked on it, but they haven't finished viewing it or indicated that they're done with the document. The green one shows that it's been reviewed. So depending on the status of the document, here I can't do anything because neither of these two documents that were shared are considered reviewed, like finished with on the Chris side. But if either of these were, you can see that if a coordinator has reviewed the document, has looked at it and said, okay, I've seen the document now, I've taken action on it, I would then be able to select that document here and delete it or make it to come off the list here. So that would be color coded in green. So that's a nice feature. You can kind of see the status of whether they've viewed the document or not, or if maybe it's in the middle of being reviewed. That's kind of a good feature. And then I think the only other thing to show here is the coordinated care plan. And we looked at in Chris, you'll look familiar. We looked at the coordinated care plan. And Chris, I made some adjustments to it. So if I'm scrolling down, here's where I documented, what's most important to me right now, what concerns me. We had some information about the allergies further down. Yeah, down here. So this is because it was made available to the provider. This is what I'm seeing here. I can make an adjustment now. I'm just going to, let's just say I'm going to edit just for simplicity. I'm just going to edit the same section here. So I change the husband name. What concerns me most about my healthcare right now? I seem to be much more slowly than I would have expected. I seem to be recovering much more slowly than I would have expected, for example, just something to show a change in the record. And then I save that. So having saved that now, it'll show up, and I'm going to go back in Chris and show you a couple of the things that I did here. It also has an audit log similar to what we saw on the Chris side, right? A history of who went in, what did they look at, what did they change, who did it, when did they do it. So some nice privacy and security functionality there as well, on both in HPG and in Chris. Okay. So that, I think we can leave it there for the HPG functionality. I'm going to return to Chris if that's okay, and just to look at the coordinated care plan again. right? I'll be able to see, I'm just going to click on the care plan here. Maybe just if I go to the audit so I can see that. Here, so here's a bunch of actions that were done from someone at Bayshore, and you can see the date and what was changed and who made that change. So all this stuff is, so at least these ones at least are things that happened in Bayshore. Updated sections, care plan viewed. Okay, so that's a good feature to have. And then I'm going to go to, I'm just looking at the time, making sure we've got enough. To the provider level, I'm going to select Bayshore. And under the provider level, there's a section here called provider notification. So in addition to things coming in through the tasks on the dashboard that we talked about last week, you can see some notifications, both outbound notifications, things that were sent to the service provider, and inbound notifications. Right, initial report, I did a couple just for examples for testing, but you can see some things that are coming in via the from the HPG user by provider notification. But again, those will be captured in the task, like the notifications and your dashboard as well. Okay, so just I know I'm saving this for last, but I want to show you now. This has come up a lot in some of the questions, and I know you're very interested to see the Provincial client view. And then after that, we're should have time to do to discharge this patient and wrap things up that way. So I'm going to go to. I'm going to open up. So I'm go back to our overview. Rather than come up with a context or an example like in our story, I'll just assume you guys will have various reasons and contexts of when you would need to do this. But basically, there's a patient in HNHB, and I'm going to do an example of someone from Toronto Central who's needing to access the patient record, maybe for whatever reason. They need to go in and either start a new chart or just to see what information, what the service plan is on happening at the other at HNHB. So I'm going to, from here, this is just a general CRIS functionality that I want to show you. You can, there's a button that will open up a new window right next to the in the middle of the client header. And I'll open up a second window, if you will. Sorry. Okay, so I just want to have this be clear as possible. So this back window is HNHB. I'm pretending now that I'm at Toronto Central. All right, so I'm going to be doing a client search. Again, I'm using the just not the best practice. Health card is better, but I'm doing a search for Athena. Now, when I do a search for Athena, right now, my default view is that it's looking for all clients, not in any particular caseload, but in the display, I've got, by default, it's searching for active patients. So in my instance, in Toronto Central, this patient is not active, right? But if I click on all, then I should see, the patient shows up here. The important thing to note here is that when you look at this line, you see the status is showing up as inactive here. Again, I'm Toronto Central, but then you've got this little flag here. I'll make that a bit bigger for you. Make that large too. Right. So there's this little I information symbol. It says they're active at HNHB. So you can kind of tell right from there that that's the case. And I'm going to click on the client name now and show you what the Provincial client view looks like. Okay, so at the top of the record now, you'll see, basically you see the home address, and this is our record in Toronto Central. So there's all that referral information and the services and equipment there's nothing here because we don't have that information in our chart, but you can select this arrow here. So right next to the client ID number, there's this little button, and that shows me and will take me to a view of it's kind of like a view of that overview screen, very similar to what we saw in HPG as well. That kind of panel. So this is basically that functionality now. So you got the things like the client number, demographic details, present location, home address. Yeah, I'll make that a bit bigger. And then here I don't have an expand all button, unfortunately, but I do have, I can click on their different, these are all that information on that overview tab is available to you now. Read only, obviously, here. So you can see those, the referral types that were in place. Services, you can choose to see just a quick summary or more detailed view. This would be even more relevant if that was like a frequency based. You can kind of get down to that level, right? And then the equipment and things. So all of these just expand. It's not I can't expand all like in the other case, but any personal contacts and so forth, medical contacts. If we had any, I forget if we put that. No, allergies and so forth, right? So you've got, it's really just a summary for the most part of that main overview screen. So this is the provider, the provincial client view. I know I don't have a lot more to say, but it's quite straightforward. And yeah, so if there's, I know there probably, I don't see the chat at the moment, but there'll probably be questions about it. I did want to make sure that I've got enough time to just kind of wrap up back with our patient in HNHB and show you a quick example of the Discharge Wizard. So as we've been saying, and Chris, there's a number of efficiencies and tools that kind of make things nice workflow and process to do certain actions like adding services or changing addresses or putting them on or off hold. Another thing you can use is what's called the Discharge Wizard, which kind of looks at everything that you might need to do in order to discharge the patient. So we've got some active services, we've got equipment and supplies. And different things going on. So this Discharge Wizard will kind of take all of that into account and notify you or provide you quick access to either close or pick up or discharge whatever elements of the patient record that you want to close. You can choose what you want to act on now or act on later. And the way I'll do that is, let's say I'll discharge the home care referral. So I'm going to, from the main overview screen again, I'm going to click on home care. I've got about 5 minutes here. And at the referral level, this is now the referral level, there's an action drop down for that referral, which is the Discharge Wizard. So I'm going to select that and click go. And basically it just walks you through, like I said, it's going to walk you through all the things you need to consider. So here it says we've got a walker in place, and you actually, it's giving you, it tells you at the top of every section what you need to do. So this they have some rental items. We have to complete the rental discharge information and then click next to continue. So if I was to click on the hyperlink, it takes me into the equipment screen, and I can indicate that the pickup date, the actual end date, is going to be today or whatever it might be. You can have a disposition of, maybe it's been picked up, returned by the client, whatever is the case. There's some vendor instructions if you need to put any there, and then I can save that. And then it just lets me proceed. You can also bypass and skip any steps along the way and come back to it later. Rental item has been ended. So now I'm going to go next. And we've got some service in place here. It's saying client has active service, so make sure you deal with that. It's essentially what this header is saying. So I'm going to click on that hyperlink. It takes me to the service screen, and I can select end that today, and just putting in an end date. Disposition is maybe out. I thought I saw, yeah, community services, let's say. And if you're expecting, this is, for service types where they expect reports. So if you're expecting a report, they have a date of when you want to get that report by. You can have the option to put some additional notes if you want. Otherwise, I'm going to save and continue. Yeah, so I'm just going to select next here. And then we had also the ODB, the Ontario Drug Benefits for the medication coverage. So that was in place for a few months, I think we had it. So you can end that as well. And I'm going to save that. And it's also telling me, I'm not reading everything, but it's also telling me, okay, you've just closed that or discharged that or finished that, and a notification will be sent to that provider or to that vendor or to that pharmacy. That's all automated. You don't have to think about it. I'm going to go next. And then you might have a number of manual tasks or tasks that you have in your dashboard. So you can select those to, you just basically telling you, here they are. These are some tasks. You might have to deal with them, read them, action them, whatever is necessary. And then otherwise, if they are dealt with, you can just, I can check all. That's faster. And then you can just delete those tasks. They don't want to leave any unaddressed tasks in the record. Now, let's say I didn't want to, I didn't complete them all, and I had to take some action on some of them or read them. I could go back and to the dashboard, do that, and then reinitiate the Discharge Wizard, and it would bypass everything I've already done and come right to the thing that's next, which is dealing with those tasks and pick up from there. So it's saying they've all been deleted. Click next to continue or cancel if you want to stop at this point. So at any step of the way, you can stop and then kind of pick it up later. But it's taking us now to the last screen, which is discharging that referral. I think we said community services was the reason. You can decide if the goals are met or not. And I can finish, and I can select finish and add note. Often when you're doing things in Chris, you want to also do your documentation, but I'm just going to say finish for now. And then I think it will say, yeah, sometimes it'll say, oh, there's also another referral open. Do you want to deal with that now? Yes or no? I don't remember why it's not asking me that now, but so I've basically done the Discharge Wizard for the home care service. And so now only the community service one is showing up as active, but if I select all in the status here, then I can see the home care one is discharged and everything associated with that is discharged. Sends a provider notification to the provider who is Bayshore, who is associated with that referral. If that was the only referral, then that provider no longer obviously would be able to have access to that record anymore. So that takes us exactly to what I was aiming for in terms of the time. We wanted to leave about 10 minutes at the end for any questions and so forth. But we just also wanted to wrap up a little bit with a bit of a summary today, as Lisa did to kind of kick off the day. So to wrap up, we learned about the e-notifications that we performed to take the patient off hold. We demonstrated the care coordinated plan that promotes information and care plan sharing among the interdisciplinary team or healthcare partners to enhance patient care. We also, through that, we saw how HPG is a robust integrated application and supports the care coordinated plan by having the ability to add, we can update and view care plans by members of the patient's care team. And HPG also serves as the interface for service offers, orders, billing, invoicing, document sharing, and e-referrals. After that, we looked at the Provincial client view, and that provided us a view of the current information from the client's record from the viewpoint of another tenant. And obviously that's beneficial in providing a summary of the client's current care plan and an efficient method of exchanging information to help reduce the amount of documentation that's transferred between tenants and improved efficiency through quick access to that information. And so in supporting of the care planning, I also showed you another referral type, community services, and the fact that Athena was ready for discharge without the need for home care. I finally just demonstrated that the Discharge Wizard that takes you through the sequences of steps to address completing when discharging the client file in Chris. So that's a really quick, it's a lot of information to take in 3 hours, 3 days. But I think it's a good snapshot of what Chris has to offer. And rather than take up any more time for me talking, we'll just open it up for you guys if you have any questions at all about today or any of the any of the 3 days that we covered so far. I will maybe stop sharing my screen here.
Thanks, Mark.
And I'll open it up to questions. Thanks, everybody.
I'll go to the chat first. So we did have a question about the audit log, and if people want to look in the chat, there's some information there about how the audit log works. Then there's a question around, do you also have job aids for Chris?
Oh yeah, a very robust set of job aids on everything.
Okay. There's some questions about, this is more about future state, so I'm not sure in theory if you'll know the answer to this yet, Mark or Lisa, or maybe Peter if it's on the line. So in a situation where there would be more than one Chris tenancy, would both tenancies be able to be viewed as a summary on the provincial view as well? Like, would they all come together, I think is what people are asking, into one view if the patient has a record in more than one Chris tenant? Or maybe we don't know yet.
Yeah, if it's future, I definitely couldn't say. I know now it's you pick the tenant that you want to see the view of, and that's what you see now. But
that's
future,
what you see now.
I couldn't say.
Okay, that's
so
good.
I can chime in here a bit, Mark. Yeah. Sorry.
Peter.
So we are working towards a new modern version of Chris for HCC modernization. In that version, we will be including, as you were seeing on the client overview, where you would see the referral services, equipment and supplies. You will see across the tenants within an instance a view only of that information. So that will be shared.
Okay, that's great. Thanks, Peter.
Yep.
And there was a question about billing that's in the chat. And this is likely coming from the fact that in the future, we're expecting this might have to work a little bit different. And again, Peter, I'm thinking that's maybe future state, something that will have to be worked out.
That's correct. So in terms of billing, we're not 100% sure how each of the leading projects will want to pursue that. So as we go through our workflow sessions, we'll kind of look at those different areas. With the new capitation model, things might change. Billing might not be such a focus. It might be more geared towards the client population, and we'll look at all those details.
Thanks, Peter. And then do you have an expected timeline for the newer version of Chris related to home care modernization?
Yes, we're probably looking at a July, August timeframe. We haven't nailed down the date yet.
Thanks, Peter. Mark, you probably know this. Where can people find the job aids?
Well, we have on SharePoint, basically is the short answer. We have like an education portal. We've got a Chris user guide, another section. What we found is that since when everyone at the LINs anyways, so the HCCSS changed the emails, we had to now kind of re-establish access to those. So and I'm able to do that for at least for the folks who are part of the LINs. It's kind of email based, and so I don't understand enough about everyone who can get access or the nature of that, but there's a spot, and I know how to give access to at least the HCCSS folks. I'm not 100% positive how that works for anyone who might not be. So we might need to take that back. I can make things available other ways by email and so forth, but in terms of granting access to the site, I might need to do a little bit of digging and understand how that works exactly.
Okay, I see Nisha's got her hand up.
Yeah, hey Nisha.
No, I was just gonna ask, like, if the documents, like the job aids, if it's not, the whole gamut, or if there's like a folder or something, we can create a folder on our shared point and put it on there so that you're not having to do like additional access, and everything is sort of in like the one-stop shop for the LPs and our shared team site. So if you want to send over like job aids and whatnot, we can host it there so that you're not having to give additional access to other people.
Sure. I'll talk, Peter, we'll talk about that, how that will work exactly, but sounds good.
Awesome.
Excellent.
Thank you.
Thanks, guys.
Okay, that yes. There's a question in the chat, Peter, about if we're rolling out I'm not sure if you can answer this. If we're rolling out a newer version of Chris in July, August, and the projects are trying to go live in September, would that version be very different? I think what this question is getting at is like concern around getting people up to speed in time for a go live. And I'm not sure if you can answer that, Peter.
It will be different. We will have more information that is shared, but generally speaking, what you saw today will be the same. We're not making any functional changes in that sense. We have a training instance that will probably release a month or so earlier, or 6 weeks earlier, that we can go into as part of the onboarding process and the go live. We will be providing training. So a lot of that will be reviewed over the summer.
That's great. Thanks,
Yep.
Peter. Those are all the questions I see in the chat right now. One question that came through earlier via email was the provincial client view. Who can access that? Mark, is it just hospitals? Is it any HIC? Is it any healthcare partner who'd been added to the coordinated care plan? Like, how do you determine who can see that?
I don't know if Peter or Nevenka might be better suited. I know historically it's other LINs. I'm just keep saying LINs that have it, but the HCCSS. I don't know if that hasn't been. I don't know. I don't know if that's expanded to hospital. We have staff in the hospitals, but that's still HCCSS folks. So I think it's only been that so far. But again, going forward, I don't know enough about how that works. Peter,
Okay,
I can chime in a bit.
Yeah.
So provincial client view or provincial client summary view, it's accessible across all the instances of Chris where there's a shared patient. So that you would see specifically for patients that are active in 2 or more instances of Chris. I think the data is available for a certain limited amount of time as well and I think there's a sort of privacy perspective on that as well.
Okay, yeah. I think the question might have coming from like when a patient like Athena transfers to the hospital back in the community, maybe it's back in the hospital. Could a hospital staff member use a provincial client viewer to see what was received in the community last time? But I think the answer is only HSS staff who are working within the hospital, assisting with discharge planning or flow or those kinds of things. Not necessarily all or any.
It's not restricted to the user. It's based on the assigned Chris role. So it doesn't necessarily mean that the hospital user wouldn't be able to see it. If they do have the correct permission in Chris, they will be able to access it as well.
Okay, so it's based on permissions. Got it.
Yeah. And we also have HPG, which also has a client summary view. So hospitals will always have access to HPG.
Right. Okay. So then the question in the chat maybe about community paramedicine, does that answer that? So would community paramedicine be able to use HPG to view the coordinated care plan, for example, or other aspects of the client's care?
I would say yes. I'm not too familiar with that program, but if they have access to HPG in the same fashion as a hospital, yes, they would.
Mm-hmm. And I'd assume, Peter, there's a process for onboarding healthcare partners to HPG. If we know these partners are going to be part of our patient circle of care, then I assume there's a process to get other healthcare organizations, trained, I want to say, in HPG.
Yes, there is. And we can continue those discussions with home and community care when we go through our working sessions.
Excellent. Okay, well, I see we're over time actually. So thanks so much for answering all those questions. Again, the session's recorded. We're working to get it into a format that's easy to share with both internal and external partners. And please reach out. I'll put my email in the chat if there's any other follow-up questions, and I will send them along to the team. Thanks so much to Lisa and Mark and Peter and Nevenka and everyone for providing this education and this kind of level set to everyone on the call. Have a great day,
Thanks so
everybody.
much, everybody.
Great, thank you.
Thanks.
Janine, quick question.
Yes.
PwC, we're expecting an email from them, right, for PIA?